Hernias or fatak as they are known in Arabic are a very common problem. Men and women both can be affected by it. Usually the hernias that men report to us with are in the groins or near the place where the thighs and the abdomen meet. In the case of women, it is more often in the region of the belly button following multiple pregnancies. Now hernias are a nuisance problem, they are not a dangerous problem. What happens in hernias is that because of some local weakness of tissues, sometimes something from one side of the area tries to go through this weak area to the other side. This is not easy for the body to manage, and therefore it is accompanied by some pain, sometimes the presence of a swelling which either may stay as it is or may go back and come back once in a while. But more often than not, in men in particular, this kind of a hernia, if neglected, can become a bit of a problem because it may descend into the scrotum, and that means that over a period of time they may have constant pain. Very rarely such hernias can reach a very large size, leading to difficulty with digestion, sometimes even associated with obstructive symptoms or blockage symptoms, which can lead to vomiting and need for an emergency surgery. Normally what we do is we do an ultrasound scan, which is the simplest and the very easy investigation to establish the presence of this weakness and the hernia. Once it is established, invariably in the case of hernias, medicines will not make the hernia go away. In other words, once it is diagnosed, most people with hernia will require some form of surgical intervention. It is usually done by cutting just over the hernia, putting all the things that are trying to come onto the wrong side back where they belong, and then repairing the area either by simply applying some stitches or by using a special cloth-like material called the mesh. Nowadays, because of advanced technology, we can do all these operations without giving big cuts. What is called as laparoscopic surgery, or what is called as minimal invasive surgery, or also known as endoscopic surgery, or in local terms it is called min mandar, so that there is very small cuts on the body, but the same effective operation is done from inside the body as would have been done had the operation been done with a big cut on the outside. The recovery is nearly the same for both types of operations, and usually patients are able to go home within 24 hours of the operation. Yes, there will be some discomfort after the operation for a few days in terms of a little dull ache, but usually they respond very well to simple painkiller tablets. Within a few days, the patients can go back to work. The only precaution to be taken, especially in case of large hernias that have been there for some time, in other words where the hernial defect or the opening is large, is that one should not lift heavy weights for 4 to 6 weeks. Also, it is preferable to protect that area by simply putting a hand to support the region when one tends to cough or sneeze, or avoid such heavy exertions such as constipation and straining and doing severe exercises including yoga. So once these things are taken care of, in about 4 to 6 weeks after the operation, the hernia would have healed completely and one can go back to an absolutely normal life.